Bisphosphonates and osteonecrosis. This is one of the important topic from oral medicine, surgery as well as pharmacology point of view. Bisphosphonates are a class of drug that stops the bone resorption activity, thereby preventing the loss of bone density. It is usually used in conditions like osteoporosis. The name bisphosphonate comes because of the presence of two phosphonate groups usually attached to a carbon molecule. A bone has two types of cell, a bone forming cell named osteoblast and a bone destroying cell called as osteoclast. So a normal bone turnover means there is equal amount of bone deposition done by osteoblast as well as equal amount of bone resorption done by osteoclast. So these bisphosphonates, they act on the osteoclast. They bind with the osteoclast and they lead to apoptosis or programmed cell death of the osteoclast. Thereby, the number of osteoclasts in a bone cell gets reduced. Because of that, bone resorption slows down. So, the indication of bisphosphonate is in condition where there is either increased amount of bone resorption taking place or there is decreased amount of bone deposition taking place. So when there is an imbalance in bone turnover, that is when there is reduced formation or increased destruction, you can give bisphosphonate in such condition. So in cases of osteoporosis where there is reduced amount of bone deposition, if we give bisphosphonate, it delays the bone resorption rate, thereby it neutralizes the bone turnover rate. As well as it can also be given in condition where there is increased bone resorption activity. For example, the multiple myeloma, to control the hypercalcemia in cases of cancer metastasis, in Paget's diseases of bone, in secondary osteoporosis due to corticosteroids and other bone disease where there is higher bone resorption. There are three generations of bisphosphonate. First generation includes etidronate, tilidronate. Second generation includes pamidronate, alendronate and ibandronate. Third generation includes residronate and zolendronate. Apart from the indication of bisphosphonate, one of the important feature related to it is osteonecrosis. So bisphosphonate related osteonecrosis of jaw, or also called as bisphosphonate induced osteonecrosis of jaw, is when there is exposure of bone in the oral cavity. So this clinical feature almost resembles the feature of osteoradionecrosis. But to term it as bisphosphonate related osteonecrosis of jaw, you need to have three diagnostic criteria. It includes previous history of bisphosphonates, exposed bone which requires at least more than of 8 weeks of exposure, and no history of radiation therapy. The moment there is history of radiation therapy, it comes under the osteoradionecrosis category. So this bisphosphonate related osteonecrosis of jaw, you can categorize them into three stages. Stage 1 is asymptomatic exposed necrotic bone without any soft tissue involvement. The treatment for that is a simple chlorhexidine mouthwash. Stage 2 is when there is presence of symptoms like pain and inflammation along with the exposed necrotic bone. There is soft tissue inflammation with swelling or secondary infection. So the treatment for that is a chlorhexidine mouthwash along with an appropriate antibiotic like an antibacterial or an antifungal depending upon the secondary infection. Stage 3 is when there is a presence of pathological fracture, and that pathological fracture should be because of the osteonecrosis and not because of a condition like metastatic disease. So when there is a presence of pathological fracture, the treatment for that would be, apart from the antimicrobial mouth rinse and systemic antibiotics, you have to give surgical intervention. You can subscribe to our YouTube channel for more videos like this. There is a separate video for osteoradionecrosis where we deal about how the treatment of osteoradionecrosis takes place. There is also a free timetable available for NEET MDS preparation. The 8 months preparation, which involves 4 months of basic prep and 4 months of revision. The 4 months timetable for the basic prep, which includes division of all the subjects into 18 subjects, 1 subject per week. So total of 18 weeks of preparation is given in the website. You can download the same timetable format from the website. Thank you.